Our first stop is cyanosis, a bluish-gray discoloration of the skin and mucous membranes. This curious color change can occur in two forms. Central cyanosis, where the central aspects of the body and mucous membranes take on a bluish hue, is often a result of hypoxia, indicating diseases of the cardiovascular or pulmonary system. On the other hand, peripheral cyanosis, characterized by a similar color change in the nail beds and lips, is also due to hypoxia, but is commonly associated with decreased cardiac output and exposure to cold. Next, we have ecchymosis, a discoloration caused by bruising or bleeding under the skin. New bruises appear bluish-purple, while older ones transform into a greenish-yellow hue. Ecchymosis can appear anywhere on the body, often resulting from trauma like falls or sports injuries. And for those on blood-thinning agents, bruising can occur more easily. Then there's erythema, a reddened area of skin caused by increased blood flow. This is usually associated with skin irritation or injury, infection, and inflammation. If you notice redness over a bony prominence, it might be warning you of a potential decubitus ulcer. Flushing, a diffuse redness of the face that may involve other body areas, is another type of discoloration. It's typically related to emotions like embarrassment or anger, physical exertion, fever, or increased environmental temperature. Jaundice is a discoloration we often associate with impaired liver function. With conditions like hepatitis or liver cancer, the skin takes on a yellow-orange hue. This is best observed in the sclera, mucous membranes, and palms of hands and soles of feet. Pallor, or pale skin, is when the skin takes on a lighter tone than normal for the individual. This is often associated with anemia or impaired circulation and can be observed in the face, palms, mucous membranes, and nail beds. Lastly, we have Petechiae, tiny red or purple hemorrhagic spots caused by capillary bleeding. They tend to appear in clusters and are often seen on the ankles and feet, but can occur anywhere on the body. These may be a sign of thrombocytopenia, a condition where low platelet counts impair clotting and increase the risk of bleeding. In the grand scheme of things, our skin is a canvas that tells a story. It's a narrative of our health, our emotions, and even our environment. So the next time you notice a change in your skin color, remember, it's not just a pigment play. It might just be your body's way of telling you something important.